Good morning. Thank you for joining us here at New Jersey City University. My name is Rita Elias. I'm the Director of Environmental Health and Safety, and I'm pleased to present a speaker from the Hudson Regional Health Commission. Her name is Alyssa Burdnick. She's the health educator, risk communicator, and public health planner for the Hudson Regional Health Commission. Alyssa graduated from William Patterson University with her bachelor's degree in public health. She went on to attend Columbia University to earn her master's degree in health education. She is a certified health education specialist and currently works as a health educator and risk communicator at Hudson Regional Health Commission. Prior to working with the Hudson Regional Health Commission, Alyssa worked for the Department of Health of New Jersey in the field of maternal and child health. She switched roles with Hudson Regional and presently works in the field of emergency preparedness planning. Alyssa is also an adjunct professor at her alma mater, William Patterson, and teaches a course called Health EU. Alyssa's here to present on a topic and give us a corona virus or COVID-19 update and help us understand how to prevent the spread of disease. Alyssa.
Thank you, Rita. Good morning, everyone. Thank you for having me. I appreciate being here so that we can understand what is going on with this coronavirus and what we can do to be prepared and kind of limit the sense of panic that is going on now that this is declared a pandemic by the World Health Organization. So I have been going around to different agencies in the county regarding this presentation. So I've kind of been giving my health educator typical Q&A sessions and describing the disease in a little bit more detail. Some of it maybe we already know and have heard of because there's a lot going on in the news and the coverage is almost 24/7 it seems. So this slide deck is actually from the New Jersey Department of Health. Luckily they were very helpful in providing this to our health educators at the state that work in emergency preparedness. This way it helps so that I'm able to keep up to date with the guidance that's currently being updated constantly from the CDC. So thank you to the New Jersey Department of Health for this slide deck. So again, I appreciate the opportunity to be here just to give everyone a better sense of understanding of what's going on. I'm trying to keep up to date with all the case counts in New Jersey. The last time I checked was this morning before I came here, and the Department of Health is updating their website every so often. So unfortunately, we do have one death in the United States, one death in New Jersey. Unfortunately, there's a lot more in the United States, but as far as we are concerned in New Jersey, there has been one death. In Hudson County in particular, we have one case that was also a presumptive positive. Presumptive positive means that the Department of Health lab has tested for the virus. It came back positive, but it's awaiting confirmation from the CDC. So currently throughout New Jersey, there are 29 presumptive positives. Again, that one death in New Jersey, and unfortunately so. And this, of course, is very concerning, and our thoughts go out to the family that was affected by that death. So again, as a risk communicator, I am just here to let you know the information that is accurate. There's a lot of misinformation that is out there, and I would like to help just ease everyone's concerns with what is happening. So as far as what a coronavirus is, coronaviruses are their own family of viruses, just like influenza viruses are their own family. And they've been around for a while. The typical symptoms of coronaviruses, they usually affect our upper respiratory tract. So when you have symptoms of a runny nose or kind of cold-like symptoms, there's a good chance that you might have had a coronavirus in your lifetime. So because providers don't test for all of these viruses and they say your symptoms are consistent with a virus, there's a good chance that you might have had a coronavirus. There's 4 strains that typically infect humans, and why I say that there's 4 strains that typically infect humans is because coronaviruses are usually of a zoonotic origin, meaning they usually come from an animal source. So although I just said that the typical symptoms are for upper respiratory, with this new strain of coronavirus that we're seeing, it's really affecting our lower respiratory tract. So that is how the etiology and the outbreak first presented as was an outbreak of pneumonia in Wuhan, China. So this new strain is a little bit different, again, because of how it's presenting. And also that's a little bit of why we are concerned, because it is a new strain. So as with anything new, we are learning as it's happening. So again, this is why it's a reason for concern. And we have heard about other coronaviruses, novel strains. Novel just means new. We've heard about other novel strains in the past. If you remember MERS in 2012, Middle Eastern Respiratory Syndrome, and SARS in 2003. So the name of this virus is actually SARS-CoV-2. So we first heard about SARS in 2003, and this virus is mimicking that. So they are naming it 2, the second one. However, what everyone is, that was just a little bit of information for you as professionals, but the disease that we keep hearing is COVID-19, and this is the disease that is stemming from this virus. So if individuals are developing illness from the virus, they are being considered as having COVID-19. COVID just stands for coronavirus disease, 19 being December of 2019. 2019 is the month and year in which this strain was first identified. So again, novel just means new, and we first heard about the outbreak in Wuhan, China in December of 2019. Unfortunately, with everyone traveling and visiting family and friends or vacationing or traveling for work, the virus now had started to spread to other countries. And in January, late January of this year is when we first heard about it infecting the United States. So it started with a few states that were experiencing cases. Now there is a minimum of at least 38 states that have been affected. So the World Health Organization has declared this a pandemic. The last issue going on that was declared a pandemic was the 2009 H1N1 strain of the flu. So prior to this, it was considered a global, a massive global outbreak. So now that there is sustained spread person to person, it's considered a pandemic. It's also a bit concerning because there is no immunity since it is a new strain. And we are still trying to learn information of how contagious it is, how virulent it is, and how frequently you need to be in contact with it in order to develop symptoms and become ill. So there's still a lot that we are learning, and the situation is rapidly evolving, and it might even be possible that something I'm telling you now can change next hour. So we are still learning a lot about what is going on. Other recent novel coronaviruses, like I mentioned. And this slide here from the World Health Organization really shows a good kind of overall look of how the United States and other countries are being affected disproportionately. So you see here the larger circles, larger red circles show a higher number of confirmed cases. Johns Hopkins University also has a very good GIS and MIS system that can show all of these cases as well, kind of in a live feed. And the New Jersey Department of Health website has just added their cases by county so that you can see the kind of geographical spacing of where in these cases are. So again, I mentioned that this is a pandemic. We see that it's really affecting all of these countries globally. In previous talks I was giving, I was saying that there's 5 countries that are level 3 travel health notices. I just looked on the CDC website this morning, and there are a lot more countries that they're saying to avoid non-essential travel to. Also, the President of the United States as of this morning, 12 a.m., had just put into effect that non-residents, they are restricting allowance for at least 30 days right now into the United States for people that are non-residents from these affected countries, with the exception of the United Kingdom and Ireland. So doing what we can to try and control the risk, and really what we want to do with this is limit our exposure. So that's why these rules and bans and things are going into effect, so that we can limit our exposure to try and contain the illness. So although we're hearing about a lot more cases in a lot more states that are affected, the general risk to the United States is still considered to be relatively low. Again, the situation is constantly changing, so this might not be the case in a week from now. But risk assessments are being done. There's enhanced health screenings at the airports of where people are coming in from these affected countries, from Customs and Border Protection, and they're implementing these screenings to detect travelers that are showing symptoms like fever and cough or difficulty breathing when they enter the United States. We will get into symptoms in a little bit on these slides. However, those 3 symptoms are the main symptoms that people are experiencing. Again, that's fever, cough, and shortness of breath. And you do not need to have all 3 symptoms to have coronavirus disease. And it can be a combination of these symptoms, or it could just be one symptom. So you do not need to have all 3 in order to be diagnosed with coronavirus disease. Additionally, there's 2 other screening questions that are helpful in determining if someone has this disease, which can include travel history. Because again, if you're traveling to these affected countries, then your chances of coming into a contact with a case might be highly plausible. In addition, contact with a confirmed case. So of course, if you have direct contact, then you would be more at risk of developing the disease. So since we mentioned enhanced health screenings that are being done by the CDC and Customs and Border Patrol at the airports, just to talk a little bit briefly about isolation versus quarantine. And we hear a lot about the buzzwords of self-quarantine, self-isolation, social distancing is a really big buzzword. So what to know about these 2 terms? Again, it's helping to limit the exposure of the virus. So isolation is separating someone who is sick with a contagious disease. It doesn't have to apply directly to COVID-19. It can apply to other diseases. So you're separating someone sick from people who are not sick, again, to limit that source of exposure. Whereas quarantine is separating people who are exposed to the virus to see if they become sick. So they were not yet ill and that they were showing symptoms. However, they had exposure to a case. So now you're separating them to just see if they become ill so that they are not passing on the disease to others. So just to point out that difference. And again, all of this is to help prevent further spread in the United States. So when someone is returning from an infected country, since they are more so at risk for developing infection, they can be doing active monitoring or passive monitoring. So active monitoring means that someone from a local public health authority, a local health department, is checking in with this individual and having them monitor their symptoms, their fever, temperature, to report this to the local health authority. And that is done for a 2-week period. Why 2 weeks? Because that is the incubation period of the virus. So an incubation period means that you can have contact with the virus, but it might take as long as 14 days for symptoms to occur and for disease to develop from the exposure. So we are seeing that usually if one is going to develop symptoms of the disease and of the virus, that they are experiencing disease illness onset sooner than the 14 days, but that's just the maximum day for taking the ultimate precautionary measures. So The local health authority and local health department can check in with that individual how they deem appropriate. So whether it's phone calls, following up with them, whether it's an internet-based means of communication, but as long as there's contact there so that they are following that case. Passive monitoring or self-monitoring means that people are monitoring themselves and taking their temperatures twice a day, remaining alert for any signs of cough or difficulty breathing. And individuals that are conducting this passive monitoring or self-monitoring should develop a plan for if they become ill, who will they contact and how they will do so that further medical evaluation can be determined to see what would need to be done. So just to put things into perspective for our risk as well, this chart just shows the amount of deaths and hospitalizations and illnesses that we see from influenza each year. And the flu causes millions of cases throughout the United States each year. In 2007 to 2018, the latest amount of data that we have available from the CDC says that there was estimated number of deaths from 12,000 to 61,000 deaths. So flu severity is unpredictable. There could be mild seasons or more severe seasons. And healthy people can still become seriously ill from the flu. But in general, flu causes a low level of concern because we're used to hearing about it, right? Every year we have these flu seasons. We're used to it. We expect it. There might be new strains each year, but it's something that we're used to hearing about. So it's not as concerning, although these numbers really are concerning and the amount of people that are affected by it. So just something to keep in mind as well. Of course, with this new coronavirus, that's why we are so concerned. It's new, we're learning, there's no immunity, and it's a new strain. So getting back to signs and symptoms of the disease and of the new strain of the coronavirus, again, I mentioned fever, cough, and shortness of breath. These symptoms can range from mild to severe. So it seems that people that are relatively healthy are recovering on their own from this disease. So it seems as though the really severe cases and the severe onset of symptoms are usually in those individuals that are considered elderly and those that have underlying health conditions or are immunosuppressed. So because as we age, our immune system just happens to decline over time, especially if we are older. There's usually an underlying health condition like cardiovascular disease, whether that includes hypertension, history of strokes or heart attacks, diabetes, any underlying health condition. Additionally, if an individual has cancer and is undergoing chemotherapy or dialysis, anything that is not helping their immune system doesn't have its undivided attention now to fight off this new virus because it's dealing with these other underlying health conditions. So the deaths that we are seeing are mainly occurring in older adults, again, those with underlying health conditions. We saw that horrible outbreak in Washington that was at a long-term care facility, and unfortunately those deaths were all contained within that nursing home facility, and unfortunately that is the population that's disproportionately affected by it. So in addition to these signs and symptoms, I mentioned briefly about the other two kind of clinical questions that would help to diagnose whether or not you have this disease, because it's also flu season and it's also allergy season, and people are just coughing without having signs of fever. So there's, again, just because someone's coughing does not mean that they have the coronavirus. I would also like to point out that it tends to be a dry cough as well. And just to touch on the aspect of fever here, fever temperatures can range as well. The CDC and New Jersey Department of Health are referring to fevers as a temperature of 100.4 or greater. to consider that a fever. And this guidance has changed as well. We used to think anything over the typical body temperature of 98.6 would be a fever. That's not the case anymore. And it varies from person to person. If you monitor your temperature daily, you could see that you have a typical body temperature of 99.2. So again, that depends on the person. A lot of these deaths too are stemming from kidney failure that this disease can lead to. So that is something to be mindful of as well. So as far as transmission and how this coronavirus and other coronaviruses tend to spread is through a droplet transmission. Droplet transmission means when someone coughs or sneezes, those droplets are being spread throughout the air, whether we see them or not. And if they are entering into the kind of 5 orifices on our face, our 2 eyes, our 2 nostrils, and our mouth, if they are entering into our body that way, they can potentially breach our immune system and affect us. So droplet transmission seems to be the primary means of transmission for this. There is also reason to believe that what's called fomite transmission might be possible. Again, because we are learning, that's a lot of language that you'll be hearing might be possible since we're still learning about this and we don't know the exact situations of this disease yet. So a fomite transmission means if you are touching a surface that has the virus on it. So if I were to have the disease and sneezed onto a surface, whether it was a laptop or the telephone that I'm using, and now someone else happens to pick up that laptop and then touch their face after they're touching the laptop with the virus on it, and now that virus is entering into their body. So there, again, just reiterating, there is evidence that this might be possible, although it seems that the direct route of transmission is through these droplets, having direct contact with these droplets. Again, close contact with those who are sick, whether it's the COVID-19 or whether it's any illness, is never a good thing to be experiencing. You don't want to come into contact with anyone who is ill. So that is why you're hearing a lot about this self-isolation, that if you are exhibiting symptoms, please do not go into your workplace, into a community setting where you're going to be exposing other people now to this virus. Additionally, that's why we are strongly encouraging everyone to wash their hands frequently with a minimum amount of time for at least 20 seconds. So what we hear about commonly is singing happy birthday, singing it twice because we're from North Jersey and we talk really fast. So sing that chorus twice. There's also a list of like 50 other songs, hit songs, that if you're getting tired of singing happy birthday, you could sing those choruses, and that will provide ample amount of time for hand washing. So soap and water is always better to use than hand sanitizer. Hand sanitizer is really encouraged if soap and water are not available. And that hand sanitizer should have a minimum of 60% alcohol in it. So it will tell you on the label on the back of the bottle the alcohol content. So this is at least reassuring. A lot of the Purells and other hand sanitizers I've seen do have this minimum content of alcohol. So that's at least reassuring, is that's the protection you need that will kill the virus if it's on your hands. So washing our hands frequently, avoiding touching those 5 orifices on our face of how the virus can enter. Your ears are not included in these 5 orifices because the 5, your 2 eyes, 2 nostrils, and mouth are all your mucous membranes. And again, that is where the virus would come into contact with to enter your body. So how we can stop that: avoid touching your face, wash your hands, don't shake hands with people. We're seeing a lot of fist bumps and elbow bumps and feet taps, and a simple wave or a hello, smile would work as well. If we don't feel comfortable doing these other means of communicating, then a simple smile will always work, just to say hello. This way you're not touching someone's hands. Maybe you just wash your hands so you know that for your sake you're healthy and you're okay, there's no viruses on your hands, but you don't know what that other person just did. So you don't know if they just washed their hands or not, or whether they just sneezed or not into their hand, which brings you to the point of coughing and sneezing into your elbows. So I know they're reinforcing this message a lot in schools, which is great. And you never want to sneeze into your hand, especially if you don't have access to soap and water or hand sanitizer right away. So it's always better to cover your coughs and sneezes with your elbow. A tissue is just as great, and then you want to immediately dispose of that tissue into a wastebasket. So if a tissue is not available, then your sneezing into your elbow will work fine, and it will kind of limit the droplets that are being sent out into the air. So there are measures called PPEs, or personal protective equipment. It is not recommended at this time that the public wears any means of PPEs, which include N95 respirator masks, or gloves, or any Tyvek coveralls that you're putting over your clothing. It's not recommended at this time that the public wears this means of PPE, or personal protective equipment. This is strongly encouraged for healthcare workers that are trained in how to appropriately use these means of PPE and how to appropriately take them off and dispose of them. So with that being said, we are seeing people that are wearing masks, surgical masks. Surgical masks at this time are only recommended for those that are ill, and that is because ill or showing symptoms of this disease. Obviously, you could be ill, but not and other means that aren't a runny nose or a cough. But in terms of wearing a mask, for those that are exhibiting these symptoms, they are the ones that are recommended to wear a mask, because it is keeping their germs in, and you're limiting the droplets that are going out into the air that others can come into contact with. So N95 or respirator masks are what healthcare healthcare workers are using, and you need to be fit tested for these respirators. There's a special process to go through to make sure that no outside exposure is getting into the respirator cartridges in the mask. So if you're hearing that word, again, that is just for healthcare workers. Another precaution that we can take how to contain the spread of coronaviruses would be to avoid a 6-foot kind of radius with anyone showing symptoms if you can. I know that that's not feasible sometimes if we are taking mass transit, or if we are in settings where people are very close next to each other. So that is why we're hearing a lot about closings of mass gatherings, because it's encouraged to try and keep a 6-foot distance from someone if they have symptoms. This way you're limiting your exposure. So I'll be saying that a lot throughout this presentation. As you've already heard, we want to limit our exposure. So I mentioned that 14-day incubation period in regards to isolation and quarantine. And to reiterate, that is the time from when a person is exposed to the virus to when it takes to develop symptoms. So I can come in contact with the virus today, but I might not show symptoms until day 13, day 14. So we're seeing that the incubation period can be as early as about 2 days, and it seems that illness onset is happening around day 5. So there are some reports that the disease may spread before a person has symptoms. So meaning if I was exposed to the virus on day 1 and now it's day 3 and I still do not have any symptoms of the disease, it's been said that you can still transmit that virus to another person, although you are not showing symptoms. That does not seem to be the main way that this virus is spreading, just as those fomites I was talking about, or the virus on other surfaces. However, again, the language from the CDC is saying that this might be possible. So again, that's why we want to try and limit our direct contact with individuals. However, it's important to keep in mind that people are most contagious when they are the most symptomatic. So when their symptoms are the worst, when their cough and fever is the worst, that seems to be the point at which you are most contagious. According to the CDC, outbreaks are not driven by pre-symptomatic spread, meaning these outbreaks aren't happening from individuals that were exposed but did not present with symptoms yet. So that is reassuring as well. There is no treatment for this disease other than just palliative care or supportive care, hopefully at home. So what that means is that you are treating the symptoms. So you are taking fever-reducing medication at home if you have a fever, and you are making sure you're drinking your fluids and getting rest so that your body can heal. Viruses are not treated with antibiotics like bacterial infections are. So there is no antibiotic that you can take for this. For flu, we hear about antiviral treatments. Maybe if anyone has heard of Tamiflu, that is an antiviral pill or medication that you can take if you are experiencing flu-like illness. I know there are medications now that they're kind of testing to see if they will work for this coronavirus, but as of right now, there is no vaccine yet. Vaccines they go through a rigorous process of how they need to be tested to make sure it's okay to be inserting this into humans. So they go through a rigorous testing process. It can take as long as a year to about 18 months seems to be the average for when a vaccine is considered safe and effective to be distributing to us as humans. So we are hearing that if symptoms are mild and if you tend to be overall healthy, that's what's happening. We're having mild symptoms if someone is experiencing the disease. So that is fortunate for us all. So if treatment in the hospital might only be needed for severe cases. So the CDC is encouraging that if you are just experiencing mild symptoms and you are not having difficulty breathing or anything that would prompt you to go to the emergency room, they're suggesting that you self-isolate at home and try and recover on your own from this illness. Again, if the symptoms are mild and if it feels just like a common cold that you can recover from on your own, if it's that mild, then please do so. If you're experiencing severe symptoms and you're having that difficulty breathing, then please call ahead to wherever you're going, whether it's to your physician or your primary care provider. If you do not have one and you are going to the emergency room, please call ahead. One reason being so that you are not exposing everyone else that's in this waiting area to the virus and to the disease. Another reason is we don't want to overwhelm our healthcare system as well. So if you are able to recover at home on your own, that is encouraged so that we are not overwhelming our healthcare system. So we will see if we have a vaccine for this disease next year at this time. So as I mentioned earlier in the presentation, that in Hudson County, we just have the one presumptive positive case, and that individual is recovered. So we are not experiencing community spread in Hudson County. What community spread means is if someone does not know their source of exposure. So they're not sure where they got it from, who it came from, they don't think they had contact with an individual that had tested positive. That is considered community exposure. And we are not experiencing that in Hudson County at this time, which is very good. And knock on wood, hopefully that doesn't change. But we are seeing in other states that this community spread is happening, and we first heard about it in Italy as well. So if you live in an area where community spread may occur, so just make sure that we are doing all of the proactive things that I mentioned earlier about washing your hands and keeping your distance, and if you're showing symptoms, to self-isolate and practice social distancing. And again, just try and treat the symptoms. Going back to when we should seek medical attention, if we are going to call ahead, again, if those symptoms are severe. So if you're having difficulty breathing, if your symptoms are not getting better after you've been treating yourself at home and monitoring your symptoms, then of course, please seek medical attention and call right away. Call your physician or a provider right away. This list also isn't all-inclusive of reasons why you should seek medical care, so just keep that in mind. That's that little asterisk at the bottom. And ultimately, trust your instincts. You know your body best. If you're not, if you're concerned about what is happening and this hasn't happened to you before and your gut is telling you that something is wrong, then of course, please seek medical care. So again, I mentioned the populations that are being disproportionately affected by this disease, and that is older adults and people that have other chronic medical conditions. And from early information that we were hearing out of China, where the coronavirus disease first started, that also showed this information to be accurate, that people that were at higher risk were getting very sick from this illness. So if a COVID outbreak happens in your community, it could last for a long time. Unfortunately, I believe we are going to start seeing more cases in New Jersey because of the increased amount of testing that is being done. So just keep that in mind as well. So during this time, it's especially important to take extra precautions. If you have mild symptoms, maybe you feel, why should you be self-isolating if you have mild symptoms? And that's because you don't want to go visit your grandparents or visit any elderly relatives. Maybe you think it's just a cold, but it's something that can really adversely affect an older adult. So keep that in mind as well. What should the elderly and those with chronic underlying medical conditions do? This list is steps that they can take. We talked about our everyday preventive actions and avoiding crowds. This first bullet point is very important. Have medication, supplies, and necessities on hand. So unfortunately, in all the supermarkets now, we're seeing that the shelves are being emptied, toilet paper and hand sanitizer and all of these supplies. So I know people were saying, well, if this is the upper respiratory infection or lower respiratory infection, why are people stocking up on toilet paper? So that is because individuals are being told that they should have the appropriate supplies that they need in case they need to be self-isolated for 14 days. So having medications that they take daily, very important. Having frozen food, canned foods at home so that you don't need to go out to the grocery store and get these things and either put yourself at risk for developing illness or putting others at risk if you are ill. So avoid crowds as much as possible. There was a recommendation given by Governor Murphy yesterday saying that gatherings of 250 people plus should be canceled. It wasn't an executive order. It was just a strong recommendation. We are seeing that now in New York, that plays are being canceled and anything with crowd numbers of 450. So there's people are saying, where are these numbers coming from? What is the magic number? What is considered a mass gathering? So again, that is dependent upon if you have the authority to be canceling situations. Again, that is up to the authority that has that power to do so. But our recommendation from the governor was a gathering of 250 plus. Again, it is a recommendation because there's a very fine line of what you can and can't cancel, right? There's a recommendation and not an order, because what about the people that have weddings where there's going to be a crowd of 250? So weddings, baby showers. So again, that's why it was a strong recommendation that the governor and lieutenant governor and commissioner of health had said on their conference call yesterday. So COVID-19 in children, according to a study in China, approximately only 2% of COVID-19 cases occurred in children under the age of 19. In the in New Jersey, I know we and throughout the United States, we are seeing cases in individuals that are as young as 17. So there's been a lot of information, well, this isn't affecting children. So again, if you're considering a child under the age of 18, if you're just considering a child a minor, then this isn't the case, since we have seen a presumptive positive case in someone as young as 17. So any parents that have children under the age 19, especially who have an underlying health condition, should definitely talk to their healthcare provider and to have a plan in place that was just outlined on the previous slide for older adults. So I said to have a plan in place. So that's something that we really want to consider and that we're encouraging people to do. So that plan in place, meaning to have your cache of medication and food, but we're really encouraging people to prepare and plan and not to panic. So I know there's a lot of hysteria out there, especially as it seems as though these cases are increasing, and we will continue to see an increase in cases as testing is further continuing. So again, just try and be aware of the information that's out there so that we can prepare, plan, and not panic. The CDC has so much information on their website of guidance for those working in community settings, guidance for those working in schools, for administrators, for working in nursing home, for transportation. There's so much guidance that the CDC is continuously updating their website with and developing this information and this content. So please refer to their website and the New Jersey Department of Health website often. Because this virus is new and we're still learning about it, there are a lot of unknowns still. So the CDC is constantly analyzing this information. I told you that they are updating their website frequently. Information is being shared with the states as it becomes available. The New Jersey Department of Health is then sharing this information with the local health authorities. I mentioned that I work for Hudson Regional Health Commission. We do not conduct communicable disease investigations. The local health authorities have that jurisdiction and that authority to do so. So if there's ever a question about a possible case or a person under investigation in your respective county, in your respective town, please follow up with that town's health department to receive more information. So I have already mentioned about how we can prevent the spread, stay home when you're sick, avoiding others who are sick, and washing your hands. Cleaning frequently touched surfaces. So maybe we are already doing this, and maybe this sounds like common sense, but sometimes when people are experiencing panic, sometimes we forget things that we should already know. So this might sound like typical information to you that we should be practicing throughout the flu season. However, through times of panic, people are starting to forget that. So we can just reinforce these messages. In work settings, there's plenty of fact sheets about how to wash your hands that can be posted in whether it's the bathroom or whether it's putting signs where visitors enter frequently outside of buildings or workplaces. There's a lot of flyers so that people can refer to. If you have these symptoms, maybe please think twice about considering visiting or going about doing your tasks that you were going to do. So this slide again is just reiterating what we have already mentioned and what we should know. So hopefully by the outcome of this, everyone will have this information down pat, and we're hoping that this now continues throughout the year rather than just reiterating these messages during flu season. Hopefully everyone will be aware of this information so that they are practicing it year round. I mentioned social distancing, a buzzword that we are hearing. So again, just avoiding crowded public places, and we're getting recommendations from the government to do so or to cancel these gatherings. We're hearing about in New York, the late night shows they're also canceling their audiences. So they're doing these comedy kind of shows without any crowds. And again, that's being proactive and limiting individuals' sources of exposure. Practice our everyday prevention measures. So just kind of taking accountability for your own health, because if everyone were to be practicing all of these preventive actions, we can really make a difference and not only protect ourselves, but protect others. I have already mentioned about wearing a mask and why it is not recommended to do so. And at this time, again, the CDC does not recommend the use of face masks among the general public. I mentioned the different type of masks already. So the surgical masks, which you can see here on this bottom image, there's openings along the sides of the face. So that's an opening of where droplets can still get into the 5 holes that we mentioned. If you also look at this picture, the person's eyes are still exposed, right? So that's another reason why you're not fully protecting yourself because, okay, yes, you're covering 3 of the holes, but your eyes are still susceptible to droplets coming in that way as well. And we are experiencing a supply chain shortage of these products. So we want to make sure that these products are available to people that need them, and those individuals are people that are symptomatic. That N95 respirator is this top image that I had already mentioned. It must fit tightly. This is for healthcare workers that are working in settings where they can't avoid that 6-foot contact with a patient. Obviously, they're providing direct patient care. And it's also used to reduce the risk of inhaling airborne particles. So a disease that's airborne like measles, that this mask is protecting them against. So the public, again, should not be wearing N95s, especially if they are not fit tested. And this is something that a healthcare worker, a process that they have to go through to make sure they are wearing the right size of this mask so that it is protecting them appropriately. We were seeing a shortage as well of these N95 respirator masks. So there was an emergency use authorization put into effect, extending the broader range of masks that can be used and giving out guidance of how we can try and maximize our usage of these masks until that supply is more readily available. If you're planning on traveling to an affected area, there's travel restrictions that are posted on the CDC's website. They go into different categories, level 3 being avoid non-essential travel. So please refer to the CDC's website to get the most up-to-date information regarding countries that you should be avoiding. As I mentioned, I looked this morning, and the list of 5 countries has really expanded. So if you're planning on traveling, please consult the CDC's website to make sure you have the most up-to-date information. If you must travel for whatever reason, avoid contact with sick people and follow those preventive actions that we discussed: washing your hands often, avoid touching your eyes, nose, and mouth. If you pay attention to how often you touch your face a day, it's pretty interesting, especially if you have contacts or something like Invisalign or braces where you do have your fingers in your mouth. If we're flossing and just practicing normal dental hygiene, just make sure you're washing your hands before you are doing so, and before you're changing your contact, just make sure your hands are always clean. So be sure to really follow these precautions if you must travel. If you did recently travel to an affected area and feel sick, again, as I mentioned earlier, try and social distance yourself, so do not use public transportation where you're exposing people. Seek medical advice if needed. And before you seek medical advice, make sure you call before you go visit a healthcare provider's office or emergency room. And again, just follow these preventive actions. We can't say it enough. Hopefully it soaks in, and if everyone is doing it, hopefully we'll see less spread. So the CDC is closely monitoring this outbreak, and they're updating the information as they are aware with it. They're working with the New Jersey Department of Health. They're doing enhanced screening at designated airports that have quarantine stations. They're monitoring travelers that have symptoms compatible with COVID-19. They're working closely with the World Health Organization, and they're really just doing everything they can to learn more about this situation and to provide us with guidance of how we can help limit the spread. There was this health alert that the CDC was providing to screened passengers. So it was called a care package, and they were receiving information and instructions on what to do if they became ill within that 14-day incubation period. As far as testing is concerned, we're hearing about not enough test kits. That's what we're hearing about. And why aren't we getting test kits sooner? So I just want to reiterate that you cannot walk into a public lab to get tested for this virus. The healthcare provider still has to get a swab or a sputum sample in order to test. You can't just walk into a Quest and LabCorp and get this testing done. And the provider wants to try and rule out other things first before they just immediately diagnose for coronavirus disease. So those other screening questions that I mentioned earlier about travel history and ruling out the flu, so maybe doing a flu test, because if that tests positive, then chances are it's not coronavirus. So there's generally no screening done for people who do not have symptoms. This graph just shows your risk level and actions to take. Again, CDC has really good guidance about communities that have low risk or minimal risk or high risk, and what you can do for yourself based on your risk level. Again, what to do if you're sick, so if you're medium risk, and then if you're high risk, if you came into contact with a confirmed case, or if you traveled to an area with high rates, what you can do. So please refer back to that information as well. We talked about these key terms and what they mean. We defined them already. We have mentioned already preparing at home and having a 2-week supply of necessities and any medical supplies that you would need if you have a chronic health condition. And other things to think about as well, if you have a pet, make sure you have the supplies appropriate for them, or baby supplies, household items. Please keep in mind that there are options for telecommuting. So a lot of doctors' offices are now offering you to video in rather than reporting to their doctor's office. Another thing we can do to prepare is to have a sick room. So designate one room in your place of residence if possible, so that the sick individual does not have to come into contact with the rest of the household. As far as pets are concerned, we mentioned having pet supplies needed for them for a 2-week supply as well. There's been a lot of misinformation about pets being infected, but to date, there are no reports of pets being infected. If you do have COVID-19, you should restrict contact anyway with your pets. Avoid them, licking your face or sharing food with them. Have another person care for your animals if possible, in case you can pass this along to them. The New Jersey Department of Health is also working closely with the CDC and establishing guidance as frequently as they can, and they're sharing this messaging to different agencies so that they can disseminate. At Hudson Regional Health Commission, we are a links agency. What that means is that we have distribution groups, very, very large distribution groups of who we can send out the right messages to, so that each group is getting the messages that they should be getting, and so that they're getting that information as quickly as we are. The New Jersey Department of Health has these terms, these social media contacts here. So they have a Twitter, an Instagram, and a Facebook. You could follow them. At Hudson Regional, we also have a Twitter and Instagram. Our handle is at Hudson REG Health. So we are trying to post information as we receive it as well. Lastly, there is a call center that the New Jersey Department of Health has put into effect with the Poison Information and Education System, NJPIES. That number for New Jersey residents is 1-800-222-1222, a mouthful of twos. If you're not in New Jersey, if you're using a non-New Jersey cell phone, if your area code is not New Jersey, then you would call this second number here, 1-800-962-1253, if you are using a non-New Jersey cell phone. So this call center is for public callers. It's not for physicians to call with clinical questions, but it is open 24 hours a day, 7 days a week, and they're using the language line for multiple languages in case English is not your primary language. At this time, I'll open it up to any questions.
Hi, we just have some questions that we've collaborated together to pose to you. So our first one is, as housekeepers, facility staff, and security officers, is there special precautions we should take to protect ourselves?
So cleaning should absolutely be more closely attention to, especially for anyone that is doing that cleaning service. in my folder here, I have a guidance of how frequently cleaning should be done, what products should be used that are registered by the EPA to fight viral emerging pathogens, and I can share those links with Rita so that everyone is aware of these resources.
Excuse me. Next, we have, what is the best strategy to combat rumors in the workplace about coworkers living with suspected cases at home?
So unfortunately, there are a lot of rumors, and I'm getting calls about rumors going around, whether it's in workplaces and community settings. So correcting that misinformation is always the best means to do so. And you can always call your local health department to see if there are any positive cases. There's a lot of HIPAA regulations, so we can't disclose personal health and private health information. But as far as combating rumors, that's definitely an important area to cover. You want to just correct any misinformation and say, I haven't heard about this person at this time. Who did you hear that from? And encourage people not to contribute to the rumor mill because it's just causing a sense of panic among people.
How long does the virus survive?
So in individuals, it seems as though they're recovering from illness within 7 days. The virus tends to like a host to survive on, a host being a person. However, we're seeing that the virus can live on surfaces for a certain amount of hours. There's no direct timeline from the CDC at this point of the exact amount of hours it can live on a surface, but I've read on non-porous surfaces like stainless steel, it can live as long as 12 hours, which is why we really want to emphasize the cleaning of frequently touched surfaces.
Excuse me. It has been confirmed that a faculty member at the University Academy Charter High School has COVID-19. What precautions should we take?
That was at what high school?
The University Academy Charter High School, the one that's associated with the university.
Okay, so as far as precautions we could take, I would refer to the preventive actions that I keep referring to. Wash your hands. If an individual is sick, please stay home. Limit your contact with others. Clean frequently touched surfaces. Avoid touching your face so that you are helping yourself from not getting the virus.
Okay, and as for the individuals who work at that same school, should they be concerned, and what are their risks?
So if they have had direct contact, this applies to anyone that has had direct contact with a confirmed case. Direct contact meaning within that 6 feet distance, they should definitely monitor their symptoms and self-isolate as well so that they're not exposing others, since there is that potential for asymptomatic people to expose of others. And they should definitely refer to administration for information so that they are comfortable with the situation.
And when there is a confirmed case, is there any special cleaning protocols?
So it depends on the setting. I mentioned that list of EPA registered cleaning products that are proven for viral emerging infections. I can pass that information along to Rita as well. There's fortunately, it's a very long list of these products that are effective in killing the virus. So I would, take the precautions of wiping down the frequently used surfaces, any kind of surface that a confirmed case would have contact with. Doorknobs, handrails, keyboards, anything that the confirmed case could have had contact with.
Oh, thank you. And we just got a question over the live feed. So they're asking, many businesses, including NJC, are closing to public gatherings until the end of March. What is the basis of this strategy, and what are the benefits?
I think the basis of the strategy is that they are being proactive and they are trying to protect the health of the people that will be at these gatherings. It's putting people's health first so that you're not getting together a large crowd and potentially having the potential for them to be exposed to something, whether or not it is the coronavirus. It's still flu season. So I think they're being making the right choice and being proactive so that they are protecting the health because they are concerned about their employees. And what was the second part of the question?
they asked what the benefits are, but I think you
Benefits.
covered that. And then there's just another part of the question where they asked what we can expect after that time frame.
So what we can expect, information will change rapidly. Hopefully at the end of that time period, things will start to get better. We can't speculate. We won't know until it happens. And then I'm sure at that time, a new census of how the situation is occurring and how it's evolving, maybe it will be appropriate to reevaluate at that time as well if the situation does not get better.
Thank you.
You're welcome. Any other questions? Thank you all.
Well, I just want to thank Alyssa for coming here and giving us this very informative and valuable presentation. And thank you for joining us here today at New Jersey City University. Have a great day.